Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. Jayarajan Kodikannath is an internationally renowned Ayurvedic scholar, author, researcher, educator, and keynote speaker with over 25 years of Ayurvedic clinical experience in India and the US. He is currently the CEO and Chief Ayurveda Consultant of Kerala Ayurveda USA and board member of National Ayurvedic Medical Association. Under his leadership, Kerala Ayurveda USA received an award, Top Alternative Medicine Company 2023 by Pharmatech Outlook. He headed the Ayurveda expert team in the new research project development at Kerala Ayurveda on efficiency, safety, and standardization of Ayurvedic wellness solutions. His published research on an herbal composition for the management of metabolic syndrome disorders, such as type 2 diabetes mellitus, obesity, and lipid profile management, received a U.S. patent in 2022. He is the author of an award-winning book, The Parent's Complete Guide to Ayurveda. Dr. J, as his students call him for short, is a compassionate healer and educator, devoted to the mission of propagating the consciousness-based traditional teachings and practice of Ayurveda across the globe. It's so nice to have you here, Dr. J.
Wonderful to be here. Thank you.
I'm so excited to have you here, especially to share this beautiful wealth of knowledge with the coaching community. To start, would you like to share your journey into Ayurveda?
Of course. I am from Kerala, India, born in an Ayurvedic family. Ayurveda is a system that is coming through the lineage traditions for centuries. And blessed to be born in such a family. I was totally inspired as a small kid. And I was very clear what I'm going to do in future. There was no any distraction, there was no any confusion because my maternal grandparents were village practitioners. And whenever we go to a marriage function or a celebration in the temple, at least two, three of the community members, they will come and hold our hand saying that because of your granddad only, I am here today alive. So how much impact they were able to make in the community and how much deeply they were able to touch the people. I was so passionate about being one of those representatives who can handhold and heal the community and guide people.
What a blessing to change and save lives.
Hmm. Hmm.
And for those listeners who are not yet familiar with Ayurveda, are you able to please introduce what Ayurveda is?
Sure. Ayurveda is a natural holistic life science from the ancient tradition of India. It's called the Vedic tradition. And we are talking about between 4000 BCE to 1000 BCE, the initial documentation of the science. The word Ayurveda means the science of life. It contains everything. I usually say every equipment come with a user's guide. I bought a water fountain for my cats the other day, a small $25. It had a user manual, maintenance, troubleshooting, and repair, big equipments. Ayurveda is truly the user's manual for life. It is all the elements how to maintain a healthy, happy, long life. Because the whole idea is longevity, quality of health, and accomplishing the purpose why we are here. So it's a science built on the principles of nature. We are born from this nature, started the life as a single cell in mother's womb. Rest all coming from nature through food, water, and various resources. So understanding the nature, understanding our life, and how we can live a healthy, happy, peaceful, long life. That's all about Ayurveda.
So beautiful. For listeners too, so I had the privilege of taking the Ayurvedic Wellness Counselor course a few years ago, and it changed my life completely. And one of the biggest things, especially coming from medicine, you always think about an evidence based approach or
Mhm.
healing and health modalities as a science. And so I'd love to ask if you could share about the history of how Ayurveda was, I guess, given to humanity, if you will, because it's so amazing that thousands of years it's been known to mankind and how it's so relevant today.
True. The Vedic tradition contributed a lot to this world, including the idea of infinity by Ramanujan, or the zero in mathematics, in architecture, in life sciences. Ayurveda is one of those life sciences that has much more comprehensive, deeper understanding about our life, why we are here, how we can accomplish fulfillment in our life, how we can stay healthy physically, mentally, emotionally, family, as a community, how we can support the nature, and how it is going to help us as a human being. So it has all those teachings, primarily focused on the prevention, but very comprehensive clinical management. It covers both preserving the health of the healthy as well as healing people from various disorders. So it's an encompassing science, much more needed for the modern world. I usually say Ayurveda is much more relevant today than ever before. And like the pandemic, what it taught to us, right? It was a complete change in the human perception about health and the need for self care, the need for preventative management of life, the need for taking care of the nature. It taught a lot of lesson to us. And Ayurveda is the answer that will cover all those aspects what was been missing in the modern world's understanding about health and health management.
I think that was one of the most humbling things and so beautifully explained is,
Mhm.
especially as someone who's gone through the allopathic medical system, you spend your youth, you dedicate more than a decade of your life learning what you think should be enough to help people and heal people. And then you realize that it's mostly public health and prevention. And a lot of that is largely ignored in medical education. And now there is
Mhm.
lifestyle medicine and advances, and randomized
Sure.
controlled studies and research has come a long way, but they still don't
Sure.
even seem to touch the tip of what Ayurveda has to offer at all.
True, true. Yeah. And that is the relevance of Ayurveda for today, I feel. Much much needed, because there are a lot of gaps in the system. And we know that. And the community is feeling it.
Speaking of those gaps, what do you feel like would be important for coaches to know about Ayurveda or to be aware of what Ayurveda has to offer?
Wonderful. See, let's first understand what are the gaps in modern healthcare systems. It's more than a healthcare, it's more of a sickness care system. Health and disease are the two sides of the same coin, right? Whenever the structural, functional, mental, emotional processes are happening in a balanced way, that is health. Any deviation from that is called sickness. More sugar is a problem in the blood, less sugar is a problem. More pressure is a problem, less pressure is a problem. So, how to maintain that harmony? The issue is that more the modern healthcare is to address when you are sick. That is primary focus. They're also primary to help you to relieve the symptoms, and by one molecule, one target type of an option, where the whole person understanding is missing. Each system is considered as separate, but all the systems are influencing each other. So that is missing. Then it's very surprising, actually, in a healthcare system there is no much real awareness about guiding on the diet lifestyle aspect of it, medicines. And by the way, I honor and respect all the systems. Every system can offer a lot to the mankind when it comes to life saving measures, surgery. So many modern medicine has contributed a lot. Don't think that I'm, but every system has its own limitations. And the whole idea should be to bring how we can bring all the positive aspect of all the systems and to provide that to the mankind. And when it comes to the health coaching, I think it is one of the profound role a professional can take on, right? Because you think about our life, there's only a small period in most of the cases, the sickness period. Whereas most of the time, It is we are reasonably healthy, but we go through our own challenges. And especially in the modern world, it is more relevant because the way, the pace of life, the stressors in the life, and so much confusion about what to eat and what to do. And we keep changing the pyramids. We now inverted the pyramid. The nutritional pyramid. We moved from a pyramid to a plate sometime. Now we move to a reverse pyramid. What to do? So much confusion in the community. So health coaches can play a huge role in connecting with them, understanding that one individual's life, where they are in their life, what are the challenges they are facing, and be a guide for life. One of the profound roles, because I always say an opportunity to transform an individual to a better state. There is nothing more profound than that a human being can do, right? Health and healing. And from the Vedic culture and tradition, it is considered as the highest righteousness a human being can do, making a positive shift in another human being. So it's a great role. And Ayurveda gives a lot of information that can really empower. I would suggest that every health coach should have some Ayurvedic learning and understanding that can make them well rounded health coaches, because that will cover guiding somebody based on the resources available in their day to day life and managing mind. There are so many things that can make the life of the individuals much better.
Absolutely. And just as you mentioned, the power of knowledge of Ayurveda to make such life transforming shifts just on lifestyle alone without anything else, just the lifestyle knowledge. And I know you must laugh at this or just be like, oh, there's a new trend now talking about the gut brain connection or how there's intermittent fasting and how all of this was known to Ayurveda so long ago. And so it's amazing how the science is just catching up a little bit.
That's right. Many a time, these modern day researchers, I always say it is as if they have done a research to prove a point what Ayurveda has been telling for thousands of years. For example, chrononutrition, how important eating in the right time. That has been always there. Some of the ancient teaching, the first word used is in time, the rhythms, right? So, a lot of new, the gut brain connection, as you mentioned, as if, aha, there's a new idea. It has been always there. How gut and mind are closely connected, how gut and immune system are closely connected, how gut and hormones are very closely connected, and all the interconnections. How we
And
can heal the gut through the mind, how we can heal the hormones through the mind. We can use all these are as opportunities, portal of healing. Mind as a portal of healing, gut as a portal of healing, breathing as a portal of healing. So, yeah, it's very holistic.
absolutely. And your point before was very interesting, and especially considering the work you've done on efficacy, safety, and standardization. So, you had talked about obviously honoring the best of what the West and the East have to offer. Same, respect the healthcare system, grateful to have access, especially compared
Well,
to the state of the world. But it's obviously no secret the influence of big pharma and insurance industries and how our healthcare system profits when people are sick. And medications, like you said, it's sick care, but they also have incentives to keep people sick. And
mm-hmm.
so when you talk about credibility and safety and efficacy, I think it's very interesting that it comes up because, to be very honest with you, one of the most infuriating things about learning, and remember when I first learned about Ayurveda and yoga at the beginning, it was after my medical education and training. And I was like, why didn't anyone teach me this before? So much of my suffering would have been. And it is what it is. Like you mentioned, nutrition is not really there in lifestyle medicine and medical education. It's that way for a reason. I mean, it's hard to accept, but it's conscious and thought out. And so,
Exactly.
yeah,
I ask people, though they had cancer, they have gone through a surgery, they had the chemo and the radiation, and they're coming, they are asking their oncologist, is there any diet or lifestyle changes I need to make? There is nothing to offer, because that is not a part of the, I think it's a deficiency of the curriculum and learning, because that's an essential part of it. Because what help us to heal faster and better, what help us to resist further recurrence and progression of the problem, is what we eat and how we manage our life.
absolutely. For any scientist, doesn't matter what your background, you always think about credibility, legitimacy, where is this from? And so I'm so grateful you shared some of the history of Ayurveda and its
Mhm.
longstanding Vedas. And so
Mhm.
for coaches listening or for any health and wellness professional provider listening to this, when they think about holistic health and healing, how do you find a credible source for teaching? It's one of the reasons why I'm so honored to be here with you. When you think about Ayurvedic education, and I know you've done the work with the safety and standardization as well, for
Sure.
anyone looking to learn, I guess, do you have any advice as to how to find, like, how do you know what's credible and what's not and filter through all the noise?
Sure, sure, sure. Okay, very good question. See, this is a science rooted in the tradition, but at the same time with a much more advanced understanding. At 1500 BC, there was a surgeon who was doing transplantation surgeries and the first ancient surgeon of India. And the idea of warning signs, even before you get a disease, body mind systems were going to show you certain warning signs. If you are able to identify that, you will be able to prevent that individual from getting that issue. There are 19 precursor stages before somebody gets into high blood sugar as diabetes, right? 19 precursor situations you may be able to identify. So, one is making sure that whenever any science getting popular, anything getting popular, there will be a lot of providers. It's a commercial world, right? Whenever there is an opportunity. So, two things. One, somebody with the roots, following the roots, very important. Otherwise, only the certain technical concepts will be shared. Without root, it will be difficult, right? One is making sure that looking at an institution, an individual who has the roots coming from the real deeper traditional teachings, but able to explain for the modern world in a credible way where you have the evidence based approach also. It's a fine marriage between rooted in the tradition, but having an evidence based approach to its understanding and delivery. That's what we need to look for in this modern world. And at Kerala Ayurveda, I have been always very mindful about making sure anything what I teach will have a reference back to the ancient text, but at the same time, I help my students to implement in this modern world without any issues. And Ayurveda, as a mother of all healing, it can fit in everywhere. Now, you're a medical doctor. I have so many medical doctors in my program, oncologists and pediatricians and gynecologists and all specializations. And they all appreciate because this is about asking somebody to sleep in a better way, eat in a better way, and think in a better way. It's not something totally different you need to do to make your life better. You need to reframe what you do, how you do, when you do. It's just helping the people to reframe to support their mind body system. So it's very simple, but it's profound. That is the key thing about it. It's nothing rocket science, all common sense principles. Our connection to the sun and the moon and the wind and water and earth and plants and animals. It's simple but profound.
I know you've seen thousands of students go through your program, the Kerala Ayurveda Academy training, and I know your students are very highly successful professionals, all professions, like you mentioned, doctors, all different kinds of healthcare providers. And I remember you said that you think you chose Ayurveda, Ayurveda chose you. And so I
Exactly.
wonder, yeah, as you've seen all these people go through to want to learn how to more effectively heal others, what are patterns of transformation you notice within the students themselves?
It's profound. It's very fulfilling me as a healer and as a teacher of Ayurveda. Very fulfilling how they are able to transform themselves. And whenever I do, we have this completion ceremony for all cohorts of our programs. And I invite the family, friends, everybody of our students to join. And very touching. I get emotional sometimes when a family member say, I want to say something. And my daughter going through your program, this changed our whole family, and we made a lot of positive shift in our life. And I always say that what more I can expect as a teacher. what we are sharing, how it impacts individuals and their families and everybody, whether it is a modern medicine doctor or a nurse practitioner or a coach, anybody. So this will give them much more comprehensive understanding about what makes a difference in a human being, right? Where it is not just physical in nature. Health is not about your annual health checkup says all green. The health is beyond that. You are a spiritual being. You have your mind and emotions, you have your functions. So having a complete awareness will transform every professional to become a better healer who understand a human being and understand how profound what they are offering to the individual. So yeah.
I was, I have no words. It's so beautiful to hear that power and that humility and love in your voice and in the work
Mhm.
that you do.
Thank you.
And as you, it's still, I'm wondering if there's a way, obviously, you'd be able to explain this better than anyone I know ever could. Is what is it about Ayurveda, if you could put it into words, that allows it to meet any person from any background, any age, any stage, and still be relevant as today as it was thousands of years ago?
Hmm. Sure. I get this question always. Hey, you are talking about 6,000 years. A medicine invented for acidity or something 20 years ago, now it is obsolete already. Now, 6,000 years, do you think it's still relevant? The world is changing. And how Ayurveda know that there is a new disease. COVID was not there in few decades ago. How Ayurveda works, how Ayurveda will be relevant. It's very simple. Ayurveda is a system built on the principles of nature. Veda means the true knowledge, the true principles of nature. And the nature and its functions, it was the same, it is the same, it will be the same. There is no new version of the truth. There is only one truth. That was the truth, that is the truth, that will be the truth. That is why we are able to address the modern world in the modern requirement because disorders can happen only either in the body or in the mind or both together. 5,000 years before, today, and 5,000 years after. Either bodily problems or mental problems or both together. And we have finite known systems. And if you know how to manage all the systems in your physical body and your mind, it doesn't matter what is the name of the disease because all the imbalances or changes are happening in our existing systems. You know all the systems, you know what are the possible changes or imbalances can happen, and you know how to manage and handle and guide people. It doesn't matter what is the name of the new disease. Ayurveda will have a solution for it.
Absolutely, and you found a way. And like you mentioned, the people who go through the training, it's their lives, the lives of their families, their communities they're in that are changing. And I'd love if you could just share a little bit about what inspired you to write the book, The Parent's Complete Guide to Ayurvedic Principles, Practices, and Recipes for Happy, Healthy Kids.
Sure. I always had the intention to write book. By the way, I'm going to write more books because there are certain chants saying that, oh, lead me from darkness to light, lead me from untruth to truth, lead me from mortality to immortality. What is the meaning of that? And writing book, according to me, I'm going to live even after our physical existence in this. I can live through the students with the practitioners of Ayurveda to the public. So that is why I reverently want to write books. And the reason why I chose the first book topic as the parents' complete guide to Ayurveda is that, in my practice, when I was in India for about 13 plus years, active clinician, seeing 30, 40 patients a day, and here, after moving here last almost 14 years plus, I attract a lot of children in my practice. It is not that I publicize that I want to work with children more. I naturally attract a lot of children in my practice. And I've seen the struggles parents are going through. Parents love their children, children love their parents. But there is no proper guidance, right? And I also found it is getting harder and harder for parents until 5 years, 6 years, everything is okay. But after that, a gap develops between the kid and the parents. It will reach to a state that, oh, mom, have you seen that expression? When a kid says, oh, mom, it tells a lot of things. My mom finds fault always with me. She's always criticizing. She don't understand me. lot of things. I was thinking, why such a gap is coming? Then I thought, I need to contribute here. So that's the primary reason. Then, when the right time comes, there will be always something that pushing you to do that. One of my students, she's also a writer. She called me saying that, Dr. J, we should do something together. There is an opportunity for us to do this because there is no information. Then I told her, I was also thinking the same way. Let's do it. So we together created the book that is to guide the parents how you can, with the simple things, right? Certain principles you follow. It's not micromanaging parents and kids' life, but certain simple principles and the common sense principle you can follow on a day to day basis to make your kid healthy, happy, and as a well rounded human being, and supporting them in a very balanced way. And it was well received. I'm glad that I wrote that book. And yeah, so that was the primary reason.
When you were talking about the kid and the oh mom, that even rang a bell for adult relationships too, as you see it all the time. And
Yeah.
when you talk about Ayurveda and health promotion, I know there's like physical health, mental health. The thing
Mm.
that's also so humbling with Ayurveda, especially, is relationship health, wealth, career, all these domains of health. Would you like to share more on how Ayurveda is relevant to all of it?
Sure. It's all about relationship, right? Our life is all about relationship. Relationship with our parents, relationship with our siblings, our kids, relationship with our people coming to us for consultation, relationship with my students, relationship with the nature, the plants. It's all the interconnections and how we can maintain harmony in those interconnections. We get a lot of roles in our life, how we can be genuine and do the best in every role we receive, as a parent or as a healer or as a teacher, any role what we get. And there is enough guidance for all these areas what we can contribute to. And that is the beauty of Ayurveda, right? As a mom, what you can do, as a wife or husband, what you can do, gives a lot of importance to relationship. Ayurveda says life is relationship. When somebody come to you for a coaching, for example, or counseling, what is the meaning of that? It's very profound. Another human being trusting you, having a belief in you, having a hope in you, coming and opening their heart and their life in front of you, saying that please help. You, as a compassionate human being, listening to them carefully, accept them wholeheartedly where they are in their life at that point of time, using all your knowledge and experience and try to contribute and guide them to make a positive shift in their life. It is very unique. Nobody can put a price tag to that process. Of course, we may charge, etc. But the contribution what we are making as a coach or as a counselor, healer, it's very profound. It's a heart to heart connection. It is a soul to soul connection. Then only they will transform. If another human being need to follow what you are saying, they should feel that connection. They should feel that this individual is talking for me, and this individual understand my life and is very compassionate, keen in making a shift in me. Then only the coaching will work. So that creating that conscious connection, the heart to heart connection, is so important even beyond your technical knowledge, because coaching and counseling is to help that individual to make a positive shift, and that is very important. And Ayurveda also teaches the human psychology. For example, when a kid is really irritated and mad, give a little bit time and space. Don't poke and don't keep asking. Generally, in the common world, there's a saying that when the iron is hot, you should hammer, right? But in human psychology, totally opposite. You will never hammer when the iron is hot. Give a little bit time and space, then naturally that individual itself will come down and come to you, or you will have a much more window open when you give it a little bit time. So a lot of simple things you can use in your day-to-day life, in your mutual relationships, how you are managing your own individual life while you are a part of this social familial, a part of that web. And that is a real life. We need to enjoy life. We need to make sure that we are feeling fulfilled. There is a peace of mind. The interconnection brings that. You can have all resources, all bank balances, real estate, etc. But if you don't have that harmonious connection with yourself and others, you will feel like everything is zero. So, thank you for that question about the relationships and how Ayurveda sees that. Ayurveda says your life is nothing but the story, the journey of relationships.
The fulfillment that you're radiating, that's so beautifully coming. And the work that you've done and everything, as you reflect on your journey now from when you first started this role at Kerala Ayurveda years ago, what surprised you the most?
One of the surprises were when I came from India, it's a new idea, new science, ancient one. I'm taking to a modern world and also one of the developed countries. And I was confident that this is a simple science, it's a common sense science. But I didn't know that it may have that kind of acceptance and the value perceived by the modern world. And it was much beyond what I expected. One of my surprises, in fact, even the drove for me to move to America, was my first class was April 10, 2010, if I'm correct, in Beverly Hills, Los Angeles. My classes are from morning 8 to evening 6, continuous learning with a lunch break. And in the evening at 6 o'clock, after finishing my class, I'm coming out. There were three students waiting with the questions. Whole day sitting in a class, and I was thinking, my students in India, even after an hour of my class, they are in a hurry to go. I saw the glow in my students in here much more vibrant. Why that kind of a passion, draw, a connection, craving for knowledge? And then I identified people are looking for something with the roots, something with a real background, reasoning, rooted in the tradition, the story, something will never change. Where the food pyramid will never change, right? It will always stay the same because it is built on the principles of nature. Something you can count on, which you know that it will never change. What advice I am getting from an Ayurvedic coach, an Ayurvedic counselor, an Ayurvedic healing will always stay true to me. He or she is not going to change the guidance after 5 years or 10 years. A science which you can really count on your whole life and for your next generations. That is the real credibility of Ayurveda. It will always stay true and the same, always. You may use new technology, methodology for implementation as the time goes, but the principles will always stay intact. It will never change. So, as a professional, you can really count on what you are learning, and with the confidence you can guide. It will never change.
That kind of stability is rare in this day and
Exactly.
age.
Exactly. So that was very, very interesting for me to see that acceptance. And as you rightly mentioned in the beginning, Kerala Ayurveda has been the primary goal is to create confident and capable professionals of Ayurveda, whether the coaches or counselors, practitioners, advanced practitioners across the globe. And of course, building the awareness about Ayurveda and really helping individuals to take charge of their health. Health is not in the hospital. Okay, health is not in the health food store. Health is with you. You are the custodian of your health and you can take charge of your health. There is enough. 70% of your healing is in your kitchen cabinet and your kitchen garden. And you have the immune system within you to heal you. So the healer is within you. You have the resources around you to heal. Then what else you need?
Absolutely. And as you see the expansion, the National Ayurvedic Medical
Mhm,
Association, and
mhm,
also the expansion, you have a health Ayurvedic health coaching program,
mhm.
the integration now of coaching more into the healthcare system. And
Sure.
what do you see as a future potential for Ayurveda, specifically in health and wellness coaching?
Sure. Sky is the limit. Because Ayurveda starts from how much water to drink, when to drink, how to drink. It covers every nuances of life, right? For example, you can start from empowering the individuals to take charge of their health. So that means you are grassroots level. starting Ayurveda from home. Then comes to the professionals, starting from coach. For example, Kerala Ayurveda's holistic Ayurvedic coach program. You will learn the principles, of course, because any practice need to have the rooted principles. Then you have all the tools to guide them on whether it is their lifestyle guidance, what they can do on a day-to-day basis, how they can manage accepting their busy life. Many a time you have two jobs and three kids, still how you can manage and keep healthy. That could be guidance about sleep, guidance about exercise, guidance about day-to-day life management, mind management tools, breathing. So many tools available. From a coach level we can start, and it's a 300-hour program. It's about 6 months. That is the first professional program of Kerala Ayurveda. Then whole life is not enough to learn Ayurveda. So how much you want to go deeper, how much you want to go broader, and then practice itself will teach you a lot of lessons. So it's a journey. Coach then can be counselor. When you come to counselor, you will also learn about some herbs and some detoxification programs and other self-care practices, and even understanding the reason for disease, why the diseases are happening, how the diseases are progressing, so that you can be proactive in guiding people even before they develop problems. Then comes to practitioner, that will give you the primary clinician of Ayurveda, what are the common health conditions and how that can be healed through resources available to you. Then more advanced. So it's a journey and growth of a professional, and it's an individual decision how much you want to grow. There's no limit.
What advice would you give to someone, specifically an adult learner who's either a coach, a doctor, a nurse, any health and wellness professional who is
Mhm.
just starting and wants to learn about Ayurveda for the very first time?
Sure. What I would suggest is there are a few opportunities. One is there are programs like Ayurveda for Modern Living. That is more for self-help. You understand how it works. It's smaller program. Many a time, if you don't know about something, jumping into a bigger program, always there is, because you don't know what you're getting into. So there are introductory programs available. Ayurveda for Modern Living, Principles of Ayurveda. Even Kerala Ayurveda provides an Ayurveda for Modern Living program. So that is one option if you want to just test how it works, what it is. And I'm sure anybody watching that will be, of course, feeling this makes sense. Then the first professional step will be the holistic Ayurvedic coach that an existing coach can get into, or any healthcare professional can get into. And we made it in a way that it is accessible for even full-time professionals. It's not like a full-time school from Monday to Friday, morning to evening. No, we created over a period of time and curated in a way that it is doable for a full-time professional with their own family without affecting their family or their profession. With the weekend classes, once in a month, one weekend, or some evening sessions. Then a very well designed e-learning system where you can go and watch more lot of self-paced content available. So it has been very well done, and we get a lot of great feedback about that. I would strongly recommend somebody who want to really look Ayurveda from a professional standpoint, adding value to what you already do. It's not about you change from what you do to come to Ayurveda. No need. You are already doing a great work in your area as a medical professional, nurse, or even acupuncturist or massage therapist or a coach. This will give you a lot of value add that will make you more fulfilling in your practice, because you understand that you are covering quite a lot more than what you were doing before after learning Ayurveda. This is what feedback I get from my graduates who are healthcare professionals.
So many levels of enrichment.
Mhm, mhm.
Yes.
And also, as a human being, you are also a human being. A healthcare provider is also a human being. The way the system works now, health professionals are more suffering because of the schedules and the stressors, etc. And they don't have any guidance on how they need to take care of their health. They are taught to take care of others about various treatment, etc. But I see a lot of healthcare professionals are also getting into issues, their own health and healing, a lot of stress related issues. Then it's a kind of a snowball, right? When you are stress, mind and emotions are affected, then you are not able to sleep, then that add to hormonal. It's a snowball. So this will help not only as a professional, but they're also human beings. This will help them to take care of themselves.
The snowball analogy is so fitting because when you work in that environment, whether it's medicine, law, or any stressful environment like that, it's like constantly working in a blizzard and not realizing what the effects of stress
Yeah,
are on the body. I don't think I honestly understood that until learning about yoga and Ayurveda and how the subtle creates the physical, and that's a
yeah.
really big missing piece.
And life is flowing. You cannot stop, right? A professional need to work every day. I'm not able to sleep, then you'll look for what I can take for the sleep. Then you will feel some tablet will help, then that will have its own. Unknowingly, we get into the spin. It's a kind of a roller coaster.
Absolutely. And so I know we went to a lot of different places today in this conversation, so much learning from you. What is your
Mhm.
takeaway message for listeners?
Okay, very simple. Life is so precious. This finite few years on the earth as human being, it's so valuable and so precious. And when it comes to health coaching or clinicians and practitioners of health and well-being, our role is so profound. There is nothing better fulfilling as a human being, as a professional. And as I mentioned, the profound nature of coaching, counseling, and being a healthcare provider, and even from an Vedic teachings, the righteous path. Whenever we do more and more dharma, we call the righteousness, that also fulfilling as a human being, helping us to liberate and to fulfill why we are here. So please understand the value of what you have as a healer, as a coach, and a counselor, and honor every life coming to you seeking your help, and try to be passionate, honor them, respect them, and do the best what you can. That will help you to live as a well-rounded human being. You will be contributing to the healing and well-being of the community, and that will also help you. So all the best to all your listeners, Jessica, and wish you all the best. And I really appreciate the work what you are doing, because this is very important what you are doing, right? Helping this message to reach more and more people. And I want all my graduates to do the same thing what you are doing, and I really appreciate and I'm proud of you as my student. Keep continuing, and this is what we can do the best in our life. So all the best.
Thank you so much, Dr. J.
Thank you.
Thank you for listening. I appreciate you and value your feedback, so please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.centerforhealthandwellnesscoaches.com. Sending you warmth and light.